congenital labial and palatal clefts. Statistic of births of children in the world. With the clefts, statistics show us that approximately 1 to 600 plus minus children are born in the world with clefts. In Ukraine, this position is 1 to 8 or 1 to 900. Etiology of the labial and palatal clefts. Divided in exogenous causes that included physical, chemical, biological, ionization, radiation, and ecological disbalance. Endogenous factors is heredity, biological inferiority of the sex cells, and age of patients. Causes of the congenital malformations. It's from 3 to 5% heredity, polyetological it's above 90%, and environment from 3 to 10%. Pathogenesis of the cleft formation, fusion abnormally of processes that form the face. We have the Albrecht-Meyer-Begon theory, the theory of Jesus and Darcy, theory of Carnahan and Stark, and the hypothesis of the Henriksen. Combination of clefts with limb anomalies, often in syndromes. Vanderwood syndrome. In clinic consists of the cleft and two fistulas on the lower lip. The somatic status disorders. Diseases of the upper respiratory tract, violation of nasal breathing, catarrhal and hypertrophic rhinitis, the growth of adenoid vegetation, chronic tonsillitis, catarrhal and purulent sinusitis, ethmoiditis, eustachytis, chronic adhesive and periodontitis, media with severe persistent hearing loss, pharyngitis, stimulation of the vestibular apparatus, backlog of somatic development, reduced visual acuity due to anomalies, and refraction. Treatment stages and rehabilitation of the children. Firstly, we establish the feeding of the children with the cleft. Then provided the surgery, orthodontic correction, oral sanitation, speech therapy correction, with somatic training, treatment adjacent specialist, social package registration, and psychological support. Second is a physiological act performed on the principles of unconditioned and conditioned reflex. Second promotes the moving the lower jaw forward, growth of the lower jaw, formation of the right bite, activate the function of swallowing, breathing, and gymnastics for the face muscular apparatus. Indication for rope feeding. It's syndrome with Pierre Robin and premature breaks up to 36 weeks. Enteral feeding extinguishes a congenital sucking reflex. With improper insertion of the probe, the development of pneumonia and esophageal strictures is possible, and harmony jaw growth is violation. Indication for nipple feeding. It's isolated cleft of the soft palate and cleft of soft and distal part of hard palate. Nipples types for feeding children with clefts have some design. We can use the orthodontic nipple, nipple for upper lip cleft, and nipple for lip and palate cleft. These are types of the nipples for feeding that are handmade. Feeding using nipples leads to displacement of the premaxillary bone along the transversal, an increase in defect between the lateral fragments, expansion of the palate defect, and move to the horizontal place in vertical position. Obturator is used in types of the unilateral complete cleft, bilateral complete cleft, and isolated to third of hard and soft palate. These types of obturated how we do it and how we use it. Always we use the some stitch that we within what we can retract the obturator if it falls. Modern surgical treatment have the few points. We provide up to 3 months operation. In child, use pacifier or special obturator that provides feeding condition close to natural. From 3 to 5 months at all run ratio of glass fragments of the palate, the displacement of small fragment, protrusion of intramaxillary wall, perform the orthodontic treatment to correct that situation. From age 3 to 6, operate the cleft uncompleted upper lip. From 6 till 9 months through extensive operate cleft of the upper lip, bilaterally possible in 2 stages, sometimes combining with hyaluronoplasty with veloplasty. Some surgeons perform hyaluronoplasty with elimination of the defect of the alveolar bone and the anterior part of the hard palate. In the age from 6 till 12 months, primary hyaluronoplasty. Provide veloplasty or gentle uranostyle philoplasty. At the age from 9 till 18 months, Sperron methods operate cleft as a latent cleft palate. And from 18 till 24 months, after primary veloplasty, we provide the uranostaphylloplasty. At the age from 3 to 12-14 years, eliminate the secondary deformation of the upper lip and nose and secondary and residual palate defects. In 8-10 years, provide the bone grafting of the alveolar process of the maxilla, and in 12-16 years old, the final liquidation of the secondary deformities of the upper lip, nose, and if necessary, the upper jaw. Principles of operative interventions on the interventions of the upper lip. Restoration of the anatomic integrity of the upper lip, a partial elimination of the deformation of the nose, and restoration of the functional capacity of the upper lip. An operation stage provides for tissue dissection of the dermal part of the labial fragment according to one of the methods. Mobilization of the nasal windpiece and mucous membrane on the red border, oral cavity vestibule, and so in the wound stages in lower is taken into the account a new retrotransposition of tissue. Some case of the upper lip cleft with the hyaluronoplasty. Principles and surgical treatment of techniques of congenital palatal clefts. The basic principle of Sperron uranostaphylloplasty is avoiding of the most traumatic stages, intralamellar osteotomy and mesopharyngeal constriction. Employment of the effective retrotransposition of the soft tissue layers of the palate. Principles and surgical treatment technique. Mucous periosteal graft cutting out, bearing of the graft of the soft and hard palate borders, their separation from the horizontal lamina edge of the palatal bone, osteotomy of the palatal opening posterior wall, and withdrawal of the vascular nervous bundle that provides graft mobility. Removal of musculus tensor veli palatini from the group of the pterygopalatine process of the main bone, due to which maxillopalatal tissue shift back to retrotransposition is achieved. Renewal of cleft edges and lower stitch application width. This is the case of the veloplasty. You can see the cleft, separation of preparing of the grafts and separation of the bundle. Here is the hook and releasing the muscles of the tensor and providing the retrotransposition. Another type of patient with the before operation, after operation of the cleft lip, and after veloplasty. The hard palate are not closure yet. The same patient on the stages of treatment after the hard palate closure. Another patient with unilateral left cleft lip palate after the hyaluronoplasty and before the veloplasty. The same patient after the closure of all defects. Pierre-Robin syndrome consists of micrognathia, cleft of the palate, glossoptosis, and macroglossia. In Pierre-Robin syndrome, consists the adjusting the function of respiration and nutrition. Function of respiration may be positioned as a pharyngeal tube or tracheotomy. We provided with a selection of the methods of feeding, probe or combination, probe plus nipple or obturator. Surgical treatment of congenital non-transmission of the palate. And rehabilitation with orthodontics and speech